Hi, this is Nishant Narachanya, and I had post-traumatic osteoarthritis and AVN because of a hip fracture that I had many decades ago. Dr. Supreet Bajwa performed a complete hip replacement on my left hip, and he used this muscle-sparing direct anterior approach. So there are no muscles cut. Dr. Bajwa has been extremely professional, kind, knowledgeable, patient, and very caring throughout this entire process. And he has been very quick and very patient in answering all the very complicated questions that I had about the surgery, all the way up to the dimensions of individual parts of the implant. Also, I am a hemophilic patient, so the blood doesn't clot easily. So if there's a cut, there's more bleeding than the average person. So this aspect also has to be taken care of during major surgeries like the THR surgery. So this aspect was handled quite well with very good coordination between the surgeon and the hematologist during the surgery and also after the surgery. The recovery itself has been quite fast. So I was able to walk without any supports, without any walker, without any crutches, literally on the next day after the surgery. And on day 2, I was also able to climb stairs. And 2 weeks after the surgery, I was also able to cycle. So I went on a few cycling rides. Now I'm quite looking forward to this new life that I have.